the one thing I've seen is that a lot of medicine right now is going away from blanket protocols to personalized and tailored protocols. How does that fit in within the group model, the community model, where you have a number of people there, but you're still trying to take in the personalization of each and provide them without sort of these general protocols or general, treatment plans, and really try and give them uniquely what is right for them? Does that fit into this model?
Yeah, absolutely. So in the book, I go into quite a lot the fact that group medicine and personalized medicine are actually not mutually exclusive. In fact, I also argue that one leads to the other, right? The thing about personalized medicine is that there's a base layer of participation that's required to do the personalized medicine. Whatever that personalization is, typically you have to do it. So you have to take the supplement or you have to do the specialized exercise. So what you see is that most people, that's not a 0 to 1 conversation. That's like a 5 to 10 conversation. That's like after you've got some traction in actually doing some healthy behaviors, how can you personalize it? And in the book, I share some models on how some innovative functional and integrated medicine clinics have been doing things like, lab testing in a group where everyone has their own unique results on their computer. The doctor's teaching all of them about what those lab results mean at the same time. So it's super efficient, but also then patients ask questions about their lab results, and those questions actually help other people in the room. And so, everyone's getting their own personalized program, but they're being empowered by the other people in the group. And I think there's some real potential there. I don't think anyone's unlocked that at any sort of scale, but certainly, I'm thinking about, how that could work in the future. And I would also say that the ultimate personalized medicine, Casper, is people working out what they want to do for themselves. Right. It's not some expert giving them a personalized protocol. It's coming from them knowing what they need to do. That's coaching. That's what happens in coaching. You're looking at the gap between what you want and what you do and working out why that gap exists and how to close that gap. That is a deeply personal process. And that is what happens in the group every time. If you look at the group, what is the first thing that we do is we set SMART goals. Anyone who's in the business of behavior change or whatever understands the power of, SMART goals and what they do. But when is that being done in medicine? It's never being done. So the first thing that a SMART goal does is who comes up with the SMART goal? The patient, not the doctor, right? The patient comes up with the SMART goal because they're the ones who are going to have to do it. So inbuilt in that is a deeply personal standard of care.
Well, I'm a big believer of purpose-driven medicine, finding that SMART goal, finding the why you're going to get better, because for many years you've been chronically ill, jumping around. And even if given the chance, if you don't have a why, you'll probably end up diseased again. You'll probably end up where you started. So I'm a big believer of that. Yeah. And I love the idea of, tapping into your own intuition as part of personalized medicine. You have to figure things out on your own because it's not on the onus of the doctor to give you that and get you back all the way. Some treatment, sure,